So my project was done on experiential treatment on sexual addiction, how past experiences lead to present behavior. For the first slide, we'll have a little introduction to sex addiction and its origin by asking, where does sex addiction originate and where do we start as professionals? The origin of this disorder is rooted in early development, attachment failure with primary caregivers, meaning with mom and dad. And sexual addiction then becomes a compensation mechanism for this failure. And as a result, those who are most likely to become addicted to sex have a parent who has acted out sexually or a family history of sexual abuse. It's also important to note that sex addiction treatment is still new, and research and understanding are scarce. There's a great deal of shame that comes with admission, even more so when you're admitting to those who don't understand, including friends, family, and even professionals who don't necessarily understand sex addiction to a degree that would make the person admitting the addiction feel comfortable. So, in this slide, we have Kenneth Adams and Donald Robinson provide us with the essential building blocks of sexual addiction treatment. Those building blocks include shame reduction, affect regulation and attachment, and sexual boundary development. Shame reduction involves understanding the origin and function of the addiction, the difference between shame and guilt, identifying the defenses that are used to deny painful memories and feelings, using specific strategies in treatment, and ultimately changing negative core beliefs. And some of the strategies for shame reduction include establishing rapport with the client and providing education and support in defining powerlessness, taking an inventory of what led to the unmanageable life, facing feelings, and dealing with guilt. Now, this guilt brings us back to recognizing the difference between shame and guilt. Now, guilt is saying I've done bad things, while shame is saying I am bad or I am unworthy. Shame is actually the primary feeling an addict is medicating or compensating for. Under the next point, we learned that there is a causal relationship between attachment patterns in childhood and attachment styles of adults. The major task here then for the therapist is examining those attachment patterns. And when it comes to the sexual boundary development aspect, it's not about abstinence or control, because this may actually inhibit impulses temporarily, but not the obsession or the preoccupation with sex. Developing boundaries allows for a willingness to define oneself according to a new set of values and core beliefs. The client shifts away from external relief of internal discomfort, and it's actually a more self-enhancing system rather than a just self-destructing one. Now, in this slide, I want to introduce a brief multimodal experiential therapy study. we'll talk about how experiential therapy differs from the cognitive behavioral approach. CBT is a focus on the current behaviors and how to modify said behaviors, whereas experiential treatment focuses on past experiences and how those have come to impact and continue to impact present behavior. The study that we're going to talk about more in the next slide was actually conducted to assess the effectiveness of a brief, intensive experiential group therapy treatment program that was designed to treat the cognitive, behavioral, and emotional etiology and maintenance of sexual addiction and compulsivity. So taking a look at the study more in depth, we examine the goals and the results. Successful CBT requires a reduce in shame and resolving unfinished business. Shame reduction techniques are used to provide a separation between disease-type thinking, behavior, and the core self. And now, resolving unfinished business is another major goal of this treatment approach because the etiology of sex addiction is thought to be based in early childhood development. Knowing the etiology is pivotal to resolving unfinished business. It's difficult enough for a sex addict seeking recovery to work to change their behavior as it is. But when we take a more in-depth approach to determine the origins of this addiction or this behavior, it gives the techniques of the cognitive behavioral approach a fighting chance to be successful and for a longer period of time. So really this integrated approach, which involves using both CBT and experiential techniques, appears to be the most promising way to successfully treat sex addiction for the long term.